Faculty of Physiotherapy in Dr.M.G.R.Physio Education Research Institute. I have been working in this institute for the past 6 years, and today I'm here to talk about the topic an introduction to exercise therapy. So exercise therapy is a means of accelerating the patient's recovery from any injuries or diseases which can otherwise delay his process of recovery. So because of any disease or injury, the patient may, there can be a muscular inefficiency or weakness, and because of that the patient can, like his daily living can be affected or his functional activities can be affected. So the main aim of the exercise therapy is to improve all these things. So what can be the indications or aim of these exercise therapy techniques are to improve the muscular efficiency, to improve the joint range of movement, and to improve the daily living or the functional activities through the exercises we are inculcating. So basically in the techniques, certain movements are being followed. Like for active movements, in the active movements and passive movements, we have two things. So in active movements, there are voluntary and involuntary. So in voluntary, we have active, assisted, resisted, and free exercises. And in active, we also have the involuntary reflex. In passive, we have the passive manual mobilization techniques and also passive movements along with the accessory movements. So along with these movements, we also concentrate on the. So in the voluntary movements, we were discussing about certain exercises. Assisted exercise, the patient is doing the exercise actually, and the therapist will be assisting to some extent to complete the joint range of motion. In the free exercises, there is no external force required for the patient. He can do everything by himself. And another type of movement is assisted resisted exercise. Here, assistance is required when the movement is very weak, and resistance is required when he can do the movements little stronger. And in resisted exercises, and external force is being applied so that the muscle strength can be improved. So all these comes under the voluntary movements. And also we have in involuntary reflex, it takes place in the body in response to some stimulus. It actually helps the body to keep away from any injury or damage happening, and also to get adapted to the environment. So all this comes under the voluntary movements. And then we also have the passive movements. So in passive movements, we have relaxed passive movement and passive manual mobilization techniques. In relaxed passive movement, the therapist is doing the movement to the patient, and it has to be done in a very smooth manner and accurately to complete the joint range of motion and within the pain-free limit. In passive manual mobilization technique, here individual joints are being concentrated, where movements like gliding, sliding, rolling, and lateral rotation, medial rotation are being concentrated at the joint to improve the joint range of movement and to prevent the stiffness. Okay, so now we'll see about how to approach a patient's problem and how to assess and evaluate the patient's condition. So assessment or understanding the patient's problem is a very important part of the therapy, exercise therapy. So based on his condition, so what can be the causes for his problem? So understanding the patient's problem. So each patient, the cause for his inability can be different. So that has to be properly understood, and the therapist has to frame the treatment protocol according to that. So that would be more of time consuming, and also the result also has to be more of positive result. So if this time consumption and the result is going to be ineffective, or if it is not being used in a proper manner, so that treatment protocol can be stopped, and that has to be altered completely. So in assessment and evaluation, evaluation of the patient is the main part. So here the patient's medical history, the reason for his illness or his injury, everything is being clearly seen, and the test or whatever the techniques has to be added will be framed according to this. For each patient it varies, and it's not the same for all the patients. It varies with each individual, and the test protocols are also different for each condition. So we will be seeing about what can be the different methods or different types of tests that has to be inculcated in treating the patient. So now we will be discussing about the various methods of testing. The first thing will be the functional test. So functional test, as the name says, the functional activities of the patient. Actually, it has to be done in the home environment or in the working environment, which includes his functional activities, daily activities like combing or sweeping or mopping, or putting his shirt or button, or how he is doing his kitchen activities, or in the workplace how he is doing. So these things can be also like, along with the occupational therapist and the physiotherapist, both can combinedly conclude about his functional activities. So next is testing the joint range. So joint range of movement, how it can be measured. So we have a device called as goniometer. So goniometer is a device to measure the joint range of movement. So the parts of the goniometer are, so it has got a stationary arm, a mobile arm and a fulcrum. So this fulcrum is acting as a pivot point and has to be kept. So I am going to test for knee joint. So knee flexion and extension, what can be the range? So the normal range is 0 to 135. For flexion and extension is 135 to 0. So I'll just demonstrate how to do it. The position of the patient is prone lying. So I'm going to place the fulcrum over the lateral epicondyle of the femur. So the stationary arm is pointed towards the greater trochanter of femur, the fulcrum in the lateral condyle of femur, and the movable arm is facing towards the lateral malleolus. So now I am instructing the patient to do a knee flexion. So this is the position placement to how to find a knee flexion. So similarly from this range I can I can find for the knee extension also. Okay, so this normal range can be increased or decreased in certain conditions. So normal is 0 to 135, or it also varies between 140 degree. So the next is a test for neuromuscular efficiency. In that we are going to see about the manual muscle testing and about the Oxford classification for MMT. So according to this classification, it stands from 0 to 5. So 0 refers to no movement or no contraction. 1 is flicker of contraction. 2, full range of movement in elimination of gravity. 3, full range of movement against gravity. And 4, full range of movement against gravity with minimal resistance. And 5, full range of movement against gravity with maximal resistance. So with this grading and with this classification, we can find out the manual muscle power for each muscle. So the next will be the circumference measurement. So circumference measurement for each muscle we have actually. So now I'm going to show for quadriceps muscle. So what can be the reasons this measurement, the circumference, why we have to measure is in some cases like when there is a muscle weakness or muscle wasting due to some trauma or injury or any fracture, there can be a massive muscle wasting can be there. So that can affect the movement, or the joint range of movement can be affected, or its gait pattern can be affected because of this. So we need to measure the muscle girth every day. So now I'll show it for quadriceps. So now I'm going to show the circumference measurement for quadriceps. So this is a patella. So from the midpoint of the patella, so I am measuring 15 centimeters. And I'm marking the 15 centimeters superior to the patella. And now over that mark I am measuring the muscle girth in centimeters. So I have to compare this with this is affected limb. So I have to compare this with the unaffected limb also for every day, so that I will be knowing whether there is wasting or whether there is any hypertrophy of the muscle in some cases. So we can find out very easily from this, and this is a very important aspect of the testing for neuromuscular. So in the test for neuromuscular efficiency, we also have the static power test. So as the name says, static is there is no movement happening or isometric contraction. So how the muscle power can be tested for static is through a device called as spring balance. spring balance to measure the static power test. And we have the dynamic power test. So we use a DLOMS technique for this, and progressive resistive exercises is being used in this technique. And here we find out the repetitive maximum. So if the patient is able to do the lift a weight and do the movement within the joint range only once, then it is called as 1 RM or 1 repetitive maximum. And the same thing, if he is able to lift the weight and he is able to do it for 10 times within the joint range and within the pain-free limit, then it is called as 10 RM or 10 repetitive maximum. So likewise we can find out in endurance test. So the maximal power of the muscle to contract for a given period of time at a specific interval, so which can ensure about his endurance, like with how much intensity or for how long he is able to do a activity or some specific exercises. So that will say about his endurance. So the next comes a speed test. So within a particular time how much he is able to do, and that can be calculated using a stopwatch, like that. So next we have the test for coordination. So coordination, so cerebellum is the main part of the brain that is controlling the coordination of the movements of the body. So there are many reasons where the coordination can be affected. Cases like Parkinson's disease or stroke or any brain injuries, or when there is some spinal cord injuries, the coordination can be affected, and this can be found out through certain tests. So one such exercise for finding out the coordination of the movement is a finger to nose test, where the patient has to take his finger towards his nose with the eyes closed. And one more test is finger to finger test, where he has to correctly touch the tip of the fingers of both the hands. So if there is any, if this thing is not happening in a proper manner, there can be some movements like ataxic movements can be happening, where he is not able to touch properly to the tip of the nose or the tip of the finger. So that indicates his coordination is being affected, and that has to be corrected through exercises. And we have to inculcate a lot more number of exercises to improve his balance and coordination. So the next test will be for the test for sensation. In the sensation we have two types, like for primary and cortical. In the primary we have touch, pain, vibration and temperature, and in cortical we have the stereognosis, graphesthesia, 2-point discrimination and localization. So these receptors are present throughout the skin, and also in the joints also we have the mechanoreceptors. The receptors present in the joints are called as mechanoreceptors, like Pacinian corpuscles or Meissner's corpuscles, Ruffini corpuscles. All these are receptors present in the joint to find out the joint position in relation to the environment, or to discriminate any sensations with relation to the environment. So these things, the sensations can be affected in many conditions, like when there is a spinal cord injury, or in conditions like neuropathy, these sensations can get affected. So it is also necessary to do the test for finding out whether the sensation is proper or not. So along with these tests, the measurement of the lung capacity is also very important, and for that purpose we use the device spirometer. So spirometer, with the help of the spirometer we will be able to measure the tidal volume, the vital capacity, the forced expiratory volume for 1 second. So all these things can be found out with the help of the spirometer. The next test will be the test for measuring the leg length. Leg length discrepancies can be there in certain conditions, like when there is, it could be congenital or due to some dislocation of the hip, or when there is when the fracture healing is not proper, when there is a malunion or something like that, there can be a leg length discrepancy. So to measure the leg length, so I'm placing the inch tape over the ASIS, that is anterior superior iliac spine, and to the tip of the medial malleolus. This is one thing. And one more is apparent measurement is from the umbilicus to the medial malleolus. So if there is any discrepancies in these measurements. So there can be a limb length discrepancy can be there. So any shortening can be there, and this has to be measured, and the corrective methods like inculcation of any orthosis, anything to improve the gait pattern can be added. So the next thing will be the measurement of angle of pelvic inclination. So an imaginary line drawn through the shaft of the femur and through the neck of the femur. This intersecting point will create an angle that's called as angle of inclination of the pelvis. In certain cases, this angulation can vary or alter due to some problems like any hip dislocation or any fracture cases, or when the gait pattern is affected due to some neurological problem. So this can be affected. So to find this angle of inclination of the pelvis, we have a device called as pelvic inclinometer. So which can be placed over the ASIS and anterior superior iliac spine and the posterior superior iliac spine, and we can find out if there is any malalignment with the angulations of the pelvis. So all these tests like the functional test, the test for neuromuscular efficiency, the test for joint ranges, and the test for coordination, all these tests will be like inculcated into the treatment purpose for the patient, and all these are the very important approaches or inevitable approaches in exercise therapy we need to follow. And final thing is the planning of the treatment. Like after assessing and evaluating the patient's condition, according to his condition, the treatment protocol has to be planned. And whatever the plan has been done, that has to be effective to the patient. That should be a positive, or a prognosis should be a positive one. So the planning of the treatment should be done accordingly using all these tests and exercise regimen. We need to plan it properly for the betterment of the patient. So based on the assessment and evaluation of the patient's condition, the exercise protocol or the exercise regimen that has been prescribed for each condition will be showed in detail in our further videos. Thank you for watching.